Hello everyone, it's Anthony Chadwick from the Webinar Vet. Thank you so much for coming to the webinar tonight. We're very, very fortunate to be able to offer this to you free of charge thanks to the kind sponsorship of Feline Friends, which are a fantastic cat charity. It's really trying to educate clients to understand their cats better. And today we wanted to talk about, is my cat itchy? So this picture here is a really interesting picture that I'm going to show you now. It's a picture of a cat, and you can see its bum. If you're really got eagle eyes, you'll be able to see it's a male cat. There's the penis at the bottom. There's its anus, and you can see very baldy backs of the legs. Now, when I qualified in 1990, we would have said this is a cat with a feline endocrine alopecia. And we would have given it megestrol acetate, and surprise, surprise, the hair grew back. Because megestrol acetate is a hormone, we said there was some sort of endocrine deficiency, and the hair grew back. Now, unfortunately, what was really happening was the megestrol acetate had hormonal properties. It was a hormone, but it also had anti-inflammatory properties. It had steroidal type effects. And so the hair grew back purely because the cat was itchy, and we were actually reducing the itch. And the reason that it came out as this baldness was the cat was actually grooming its hair away. And then megestrol acetate caused all sorts of other side effects. And so we were really not treating the cats right. And I suppose if you go back to that period of the 80s when I was qualifying, we began to talk about the cat not being a small dog, because up until that time, you know, often we just extrapolated what we saw in dogs, we pushed over to cats, and it just clearly wasn't appropriate. So that photograph there, had I shown that to you 25, 30 years ago, we might have been having a completely different discussion. The beauty is that, of course, time moves on, we learn more, and we become more knowledgeable and better at doing what we're doing. So I'm really looking forward to this presentation today, which is based, you know, for owners of cats to try and get them to understand skin problems a little bit better in their pussycats. So what are we going to try and do at the end of this half an hour session? We're going to try and explain to you how do cats display itchiness, and that can be different from the way that you or I or a dog displays it. I'm going to show you various types of skin lesions that, you know, you may recognize from cats you've previously had or you've seen. We'll talk about the different causes of those skin lesions. We're going to talk about fleas. I couldn't find a picture of a flea that didn't have a copyright on it, and I couldn't find my old flea pictures, but I'm sure you all know at least what fleas look like. And then we'll talk about some treatment options at the end. And I should have really probably put flea life cycle in bigger letters, because that's probably the most important thing that I want you to get hold of today and to understand. Now, there you go. There's a picture of me. I pulled it off the internet. I'm a vet, qualified in 1990. I had a very special interest in dermatology, so I took a certificate in that. And then I saw cases for other vets until about 2 years ago. I'm also the founder of the Webinar Vet, and the Webinar Vet is the largest online community of vets in Europe. And our job, and my job, is to help to train vets to become better vets so that they look after your pussycats and your dogs and any other animals, you know, better than they do at the moment. CPD is so important for vets to continually professionally develop, and that's the area that I'm involved in. So small animal vet up until 2 years ago, but very much still very involved in the profession via teaching to vets by myself, but also facilitating other vets using our platform to teach vets more about their various dogs, cats, cows, sheep, horses, etc. So we said the first thing that we would talk about were the various different ways that that cats can itch. And so You know, we all probably know the cat that gets its back leg back and starts scratching around the neck, around the ears. That's clearly an itchy cat. But there are other ways in which a cat can manifest itchiness. And one of my questions that I often ask in a consult would be, does your cat clean itself a lot? And quite often the people would say, oh, yeah, she's always cleaning herself. She's very fastidious. She likes to be clean. Actually, what was happening there, if you see a cat that over-grooms itself, maybe even to the point where it loses hair, then that is a cat that is showing itchiness by over-grooming. So over-grooming is not something that should happen normally. If you're seeing your cat grooming and licking itself a lot, that is another sign of itchiness. And what's interesting about the over-grooming is, of course, as it grooms, it does indeed clean its coat. And what it will also do very effectively is remove signs of fleas or flea dirt. And so you may then look at your cat and say, well, my cat seriously doesn't have any fleas. I can't see any. But the cat has actually been removing it itself. And we know that flea allergic cats are much more effective at removing fleas from their coat, which is a self-limiting way of dealing with the disease, than cats who are not flea allergic. So just the first thing I want you to realize is, you know, just because a cat isn't scratching itself maybe like a dog would do, or like you might see some cats doing, but is merely licking itself a lot, don't think that that is it keeping itself clean. It is actually probably a sign of itchiness and over-grooming. And I'm going to show you some pictures now of some of the skin patterns, the reaction patterns that we see when cats are itchy. And some of these you may recognize, you know, from your own pussycat. So this first reaction pattern is termed in the veterinary field eosinophilic granuloma complex. So you can see different types of granulomas that form. These are plaques and linear granuloma, and then a rodent ulcer, which is under the tongue, and sometimes you can see it as a swollen chin. And you can see really quite red and swollen there. You can see this sort of nodular appearance down the back of the leg, and then this is the underneath of the hind leg, which is showing as a granuloma. The eosinophilic word, eosinophils are blood cells, white blood cells, sorry, that you see when there is an allergy. And in fact, cats and horses in allergy often show eosinophils much more readily than the dog does, who often produces a lot more neutrophils, which is another type of white blood cell. So if you see a cat with this is obviously also a sign that it's itchy, it's often red, it licks at it, it's uncomfortable. And it's one of the ways that cats display itchy skin disease, allergic skin disease. Another way, as we alluded to at the beginning of the talk, was they may just overgroom themselves and actually begin to show almost like a symmetrical alopecia. So alopecia is a posh word for hair loss. And you can see that this cat has been grooming itself over its back legs, over its sides, over on the other side as well. You may think when you see a cat with alopecia, has that hair been lost because of it licking and trauma, or has it been lost because it's just fallen out? And most of the time in cats, hair doesn't just fall out, it's actually licked or groomed away. And you may see cats sometimes almost nibbling and barbering at their hair to remove hair. But we can often tell by looking at the hair under the microscope, and we see that it's been broken off by the cat's mouth and tongue and teeth. And we can then therefore say this is an itchy cat. So if you see a cat like this and you think, is this itchy? You may not see it grooming. Some cats actually hide behind a settee to do this. And so you may not be aware that it's actually licking and grooming itself. You just see your cat losing hair and wonder where the hair has got to. So just be aware of that sort of alopecic look as well. Alopecia, just a posh word for hair loss. And then we also sometimes, when you're feeling your cat and rubbing your hand over its back around by its tail, you can often feel a sort of crunchy, crusty sort of appearance, which we call miliary dermatitis. And this is a very common reaction pattern in cats with allergic, itchy skin disease. And obviously you can't feel that now, but obviously you can see this has been displayed, I think, on the ventrum, and you can actually see these quite sort of nasty, papular, crusty type lesions. And then, of course, some cats really can concentrate around the head and neck and can really scratch, you know, with the back leg, using the tongue as well, and can cause a lot of damage, and it can be really distressing. And this is often where, you know, we may need to put an Elizabethan collar onto a cat to prevent it from really traumatizing and ripping its skin. It can be quite frustrating and distressing to look at, you know, as a vet or as an owner, never mind for the cat. And so again, with this, we have to just find out, why is that happening? Because clearly it's not satisfactory to leave a cat with a buster collar, Elizabethan collar on its head for the rest of its life. If we move on to the next slide, you can see the sort of diseases that we often see in cats. So we can see a lot of them, FAD, flea allergy dermatitis, or flea bite hypersensitivity, makes up over 50% of all skin problems in cats. Cat bite abscesses, another third. So your cat goes out, it comes back the next day, bit out of sorts, gets progressively worse, comes in, we find he's got a big abscess. We have to admit the cat, we have to drain the abscess, we have to put it on antibiotics, and these cats improve, and they're not really itchy, they just can be quite sick, and obviously swellings at the site where they're bitten, often maybe on the leg as they're running away from their victor. The other cat may plunge its teeth into the back end of the cat and cause some real problems. You can see there that atopy, which is like a sort of allergic type disease, akin, I suppose, as much as anything to asthma. So cats very prone, as humans are, to asthma. That can show in the skin as well as in the respiratory system. And then we'll have some other ones like food allergies that are sort of in there as well. Otitis externa is ear disease, something we can see quite commonly in cats. If we see that in young cats, that's most commonly caused by the ear mite that can cause some irritation. And then certain tumors can also be irritating to cats as well. But you can see how big from this diagram, how big the problem can be just from fleas. And we often don't really make the most of that in the way that we treat our cats with allergic and itchy skin disease. So moving on, you know, when I see a cat that is obviously itchy, I've recognized that it's itching at itself with my tests, with the history that I've taken, just by actually examining the cat myself. What I really come up with is three major diseases, I think. Flea bite hypersensitivity, atopic dermatitis allergy, food allergy, and then, as I mentioned there, you can have ear mites. And in very rare cases, we talk about psychogenic alopecia, so cats over-grooming because of nervousness. And then there are other rare causes which are quite rare, and I'm not going to really worry about those because common things happen commonly. And so if you've got a cat with a skin problem that's itchy, the likelihood is that the top three, one of those will be the diagnosis. And sometimes you can even have a cat that might have an atopic dermatitis allergy, but also a flea bite hypersensitivity or a food allergy and a flea bite hypersensitivity. So it may be that we've got a couple on those lists and we have to actually treat both diseases to sort the problem out. So I've shown you the different ways that the skin can react. And with flea bite hypersensitivity, atopy, and food allergy, you could see a cat that goes bald. You could see a cat that developed an eosinophilic granuloma complex. You could see a cat that was itching, a lot around its head. And you could see a cat that developed miliary dermatitis as well. So they're all the sort of pictures that I showed you earlier on. And all of them can make you think, that's the symptoms, that's the signs we're seeing. What is causing it? And until proven otherwise, I am obsessed with fleas. Now, fleas are really interesting because, of course, none of us want to admit that we have them in our house. My cat never gets fleas. If I had £1 for every time that was said to me, I would be a very, very wealthy man. So if you're coming in, and I can understand nobody wants to think that their house is dirty. That's not what it is. It's a case of we've had a beautiful summer. Cats will pick up an occasional flea while they're outside, wandering around in the mornings and in the evenings. They'll meet up with other cats. Those cats will transfer fleas over to them, or they'll pick up fleas from, flower beds and so on. And they will bring them back into the house, where very, very quickly they will start breeding. And I think to understand this, you can see here the life cycle of the flea. So the newly emerged flea jumps onto the pet, and after a blood meal, it mates and starts to lay eggs. Really needs to stay on the cat or the dog to have an effect. And the flea that we see most commonly in the UK is the cat flea. Dog fleas are not that common. So when you see a flea on a dog, it's most likely to be a cat flea. Those eggs are obviously fall off and go into the environment, and quite commonly that can be into your carpets. They develop into larvae, which then start to burrow around in your carpets, going into the floorboards, the skirting boards, all of those areas, into your sofa, down the seat wells, and they pick up human dander and material like that, and they develop from there, and eventually they pupate. Fleas are insects, very much the same as butterflies are, and they pupate, and then they develop within that pupa into an adult flea. And they can actually stay in those pupae for a year plus. And what can sometimes happen is somebody moves out of a house with cats. Then there's a period when nobody moves back in. It might be a rented house, or they're waiting to sell it and pass it on to the next person. 3 to 4 months go on. People move into the house and suddenly they are covered in fleas. And this is because all of the fleas have developed up to the pupae stage. The pupae won't actually hatch until it knows that there is somebody or something that it can jump onto and feed. And so it actually senses CO2 levels, and it senses movement. And when it feels that there's movement around, it will come out of its pupae, and it will actually then very quickly try and jump onto a host, feed off the host, and then begin to lay eggs. The adult flea, usually will probably last not longer than a month. It might be shorter than that. It can be killed earlier. But in that time, a female adult flea can lay 20, 30, 40 eggs a day. And so it means that when you see one flea in the environment or one flea on your cat, there could be hundreds of fleas in the environment. And this is the problem. And this also explains why now, with the better treatments we've got, it's so important to perhaps attack several levels of the actual life cycle. So you can kill the flea, but you can also prevent the larvae from developing by using various flea contraceptives that we have as well. So I hope that explains the life cycle. It's so important when we're talking, and this is my imaginary picture of the flea, but I didn't want to put one on that was copyright, but just go onto Google at the end of this talk and look up fleas if you're not sure what they look like. The cat flea, images of the cat flea, and you'll see it. I didn't want to put something on that was copyrighted for our talk. Very, very sort of briefly want to mention psychogenic alopecia, and that's An alopecia, a hair loss, which is caused because the cat is nervous and it overgrooms. And this is a case here where you see this cat's front legs where they licked at it until all of the hair was taken away. When we were able to sort out the kind of environment for the cat, make it less nervous, then that hair grew back. I would say that this is quite uncommon. Quite often people will say, do you think it's the cat's nerves? And I will almost certainly say most of the time there is a dermatological cause rather than a psychological cause. However, I would also say that cats who are highly strung, and you know it if you've got one of those, if they have allergic skin disease with fleas or with atopy or food allergy, and they're a nervous cat, they will probably overreact to their itchiness in a way that a more laid back cat would do. So there certainly can be an element of psychological elements to itch, but I think true psychogenic alopecia is actually very rare. And as we become more thorough in our workup of cats, it should be a diagnosis that we make very, very infrequently. So I want to talk about treatment now. And I would say there are two ways of treating. So have a little think about this. We can treat the cause of the disease or we can treat the symptom. And I think the problem is sometimes we as vets can end up treating the symptom. Your cat comes in who is itchy. We examine it. We can't see any fleas on it because it's being so good at cleaning them away. Or we might even suggest that it might be fleas, but there is owner resistance to that idea. And then therefore we give the cat steroids, which is probably our most common treatment for allergic skin disease. And the cat will get better. But clearly, if you were to ask me what is better, is it better to treat the cause of the disease? And then we need to have, as a first, with any itchy cat that I see, we have to have very, very thorough flea treatment. And what I would say as a few points towards flea treatment is, I would say, make sure that you get a good quality product. There are lots out there. You will tend to buy them, and I have no financial interest in this or anything before I start. You will tend to find those products in the vet surgery rather than just in the pet shop. Now, pet shops can now sell some really good products, but there are also some products that are sold that are really not effective. And I think the other thing that's really, really important to stress, and if it's the only thing you learn from this webinar, then this is the thing you have to remember. You can go into supermarkets and into pet shops, and if you're not advised properly, you can buy a flea product which is meant for dogs. I apologize, I've got a cough at the moment, so I don't want to cough over everybody. Which is meant for dogs, and it contains a product called permethrin, Permethrin. If you're if you've got a piece of paper in front of you, spell that out. Permethrin, write it down. Is really poisonous to cats and can kill cats. Certainly can send them into fits. Should not be used in cats. That will never be diagnosed in a veterinary practice, or should never be. There's a danger that you could pick it off a shelf and not be aware. So treat the cause, don't treat the symptoms. And I would say treating the cat and potentially treating the environment. Treating the environment is about making sure, excuse me, that you're killing any fleas that are in the environment, and you get a spray for that. So that is the end of the talk, really. I just want to come up with the final points. Remember always to that cats show itchiness in different ways, particularly from dogs. Always treat itchy cats for fleas. Steroids are safer drugs in cats than dogs, and much less likely to cause side effects. Questions, which I'm happy to answer, so do stick them in the chat box and I'll try my best. Toby says, what's the difference between a dog flea and a cat flea? The cat flea is Tinocephalidus fellis. The dog flea is Tinocephalidus canis. They look very, very similar. You'd need to look at them under the microscope to be able to differentiate them. But when we look under the differentiation, under the microscope, we can see those little differences. Doesn't really make any difference. The flea products that you will use will kill cat and dog fleas. But we will tend, if you take a flea off, take that to your vet and ask him to examine it under a microscope, it will probably it will probably be a cat flea. Apologies for my cough. Are long-haired cats more prone to skin problems or not? I would say not particularly. One of the diseases I've not talked about in this webinar is ringworm. Ringworm is a disease that is caused by a fungus. It's a stupid name. In fact, the more technical word is dermatophytosis. Ringworm is not caused by worms. And long-haired cats, like Persians, are much more likely to carry dermatophytosis than short-haired cats. But I would broadly say, you know, if you're an allergic cat, you can be long or short-haired. Is it better to use a monthly injection? Let me just see this question. Better to use a monthly injection or daily tablets, and how does this work? So Cindy's asking about monthly steroid injections or Medrone as a steroid tablet. I would always say, Cindy, that it's best to use tablets. The problem you're going to say to me is, you know, cats can be very, very difficult to tablet. Once you've injected a cat, you can't pull the injection out again. Having said that, you know, if the cat is really, really difficult, then it may be the answer. I think from my perspective, if you're having to inject every month, that is too frequent. And I wonder, you know, in that particular case, whether things like your flea treatment are as good as they should be. So remembering with fleas, you know, treat every animal in the house. Sometimes you've got 3 cats. People say, well, it can't be fleas because 2 of them are okay. 1 cat has flea allergy, the other 2 don't. You've then got to treat all 3 cats. You've got to treat the environment as well. So fleas are incredibly important. I can't really, for legal reasons, talk about all the different types of flea treatment because I think the VMD would not be happy with me. But, you know, go to your vets. There are some super flea products that you can be using. So if you are not doing enough on flea treatment, and when I talk about flea treatment, invariably that is monthly. There's a couple of exceptions to that. We do have a injectable for fleas called Program. You only have to do that every 6 months. It's not killing fleas, it's merely stopping them from breeding. But we know that part of the problem of why we see so much flea allergy dermatitis is most people with a cat only probably use 2 or 3 pipettes a year. So they think that that's enough, whereas actually, you know, you should be treating monthly. So if you then give an injection which gives 6 months protection, that could be better than just using, you know, an occasional pipette. And some people use the pipettes when they see the fleas, but, you know, a big fluffy cat, you know, it can be difficult to find the fleas on the coat. As I've mentioned, some of them will lick them off and get rid of the evidence. But even if they're on, you know, finding a flea can be really tough. So Karen is saying, well, there's a bit of history here, so I'll go through it and then we'll perhaps call it to a halt. Hopefully this has been useful for everybody. So Adama is saying, what about cats with no access to outdoors? If your cat literally cannot get a flea, and if you came in to see me, I would probably give it some flea treatment to make sure that we rule that out. Then there will be something else going on. But it's amazing when you actually quiz people closely, actually the cat does go out into the yard. So there is always, you need to make sure that, it absolutely can't get a flea because it's indoors and it never meets any other cats. And the person can't potentially bring a flea in, or, the dog that lives in the house with them. So it's important to get that history right. Claire's saying, can cats be allergic to pollen? That's certainly possible. If that is the case, that should only happen in the summer. But Claire's also saying he pulls at his fur along his spine, but only seems to do this in the summer, and the fur always grows back in the winter. If it's over the spine, that is a classic area for fleas. Obviously, fleas are much more likely to be outside in the summer because it's warm and hot, unlike today where it's now very cold and they won't live outside. So that sort of history, Claire, would always make me think about fleas, and I'd be wanting you to be using monthly flea treatment all year round, preferably, but definitely from the sort of March, April through to October time. Now we've got a good long one from Karen. My Maine Coon has had problems since we got her as a kitten. She has a nodule on her neck, which she scratched until it was an open wound both sides of her neck. This happens every June. So wonders about change of season. I've tried 2 vets who check ears for mites or fleas, but cannot explain. They always ask about food. And I've tried a variety, including no grain, hypoallergenic, etc. Also tried dander wipes and oils put on the food. Desperate to avoid medication and steroids when it gets very bad once or twice a year. In general, she scratches her neck, overgrooms a lot, and pulls tufts out, particularly along around her neck and tail base. I have 3 indoor Maine Coons, all indoor, and they have good quality flea and worm treatment. Never seen a flea on it in the house. So the good quality stuff should be coming from your vets. If they're all indoors and never go out, then they shouldn't have fleas. I often saw in my practice cats that would be allergic to dust mites. If they're inside all the time, they may have that problem. They could also have a food allergy problem. The problem with doing food allergy testing is cats are very fastidious and will change diet. But we know from some of the studies done that cats may need to be on a hypoallergenic diet for 3 months before there's a significant improvement. And the problem with that is very few people can actually follow the food trial religiously enough to keep me happy that the food trial has been done properly. If you are allergic to something, it may be less than a teaspoon given, once every few weeks, that could keep the problem flaring up. So it's very important to probably feed all cats the same diet, to not feed them anything else, no tidbits, no bits of toast, no, little bit of whiskers on top to make it more palatable. It's got to be really, really strict. And I think if you're having a problem with a case that has gone on, as with your little Maine Coon pussycat for a couple of years, and your vets are not getting to the bottom of it, then this is where I would consider asking them to refer the cat to a dermatologist in your local area. So that's certainly worth, considering. Claire is saying she's treated the pussycat regularly for fleas. So when we say regularly, I think that should be monthly. If it's not, then it's not regular enough. And it should be a product that you're getting from a vet rather than from a pet shop, because the products are, of a better quality. If it was stress related, we'd probably expect it to be all year round, and it usually occurs only in the summer. Been using some non-sticky stuff to put on his back, which has helped immensely, but wondered if it could be pollen that causing the problem. Certainly pollen would be, a possibility as well. So that's something to consider if it seems very seasonal. If it's very seasonal, I think stress is probably less likely. Peen is saying, what is your opinion on flea collars? I think there are some better flea collars. Again, I would recommend asking your vet about those. A lot of flea collars can cause irritation around the neck. They can obviously, get caught and cause problems with the cat when it's out and about. So I'm not, I think it's fair to say, keen on flea collars. So I would usually recommend tablets, or mostly the spot on the back of the neck. So that would be the one that I would recommend. Jess says, my elderly cat is suffering from itchiness. Our vet has confirmed that he has neither fleas nor ear mites, but as he has CKD, it would be better to avoid steroids. Do you have any advice? That's a tough one. As cats get older, the balance for medication and things sometimes. Again, even if you can't see fleas, I would always treat for them and see what level of improvement you get. They're not very expensive, and it can save you a lot of money in other areas. So any cat with itchiness, in my view, has to be on flea treatment. From that stage, you want to sort of see, how much of an improvement you see. These are quite complex cases. History is really important, so it's hard for me to give, advice without knowing everything. Again, if you've got a vet who's got a real special interest in dermatology in the practice, I would encourage you to go to them, because this is something that often needs longer appointment times. Is obviously therefore, more expensive, but I think that is the way that you're more likely to get to the bottom of it. I think that is all of the questions. I hope that's been helpful. Where is everybody listening in from today? Do you want to type in where you're listening in from before we call it a close, in case anybody else is thinking about another question? Lovely to know where people are listening in from. Thank you for wishing me well with the cough. I do apologize if I've deafened anybody. Nicola is asking about when all usual causes have been ruled out, what success rate have you had with Apoquel? Now, Caroline, just to full disclosure, I stopped practicing as a dermatologist 2 years ago, and I did use a bit of Apoquel on dogs. It's not at that time licensed for cats, and I think it's probably still not licensed for cats, although there is some stuff in the literature that I've seen. I don't think it seems to be quite as effective in cats as it does in dogs. And so I would be reluctant, if I was still practicing, to use something that wasn't licensed unless I had a really good reason to. We've got Ariane listening from the Netherlands. So, goedenavond, Ariane. Hope that you're doing well there. And then Kelso, Manchester, Caterham in Surrey, Cumbria, Poole, Dublin, Serbia. That's lovely to hear you all the way from Serbia, and Leicester as well. So lovely to have you all on. I hope that's been helpful. The boring advice at the end of these is always, if you have a clinical case, your cat is not well, has a skin problem, you've not been making progress with it, the vets won't mind you going in and saying to them, look, is this worth having a referral if we're not making the progress that we should? The advantage for going to a referral is you have a longer time for the vet to look at the pussycat. And obviously, the vet who's looking at it will almost certainly have another qualification in dermatology, and should hopefully have a better chance of getting to the bottom of it. Some cases are really very complex, and those people who can spend a bit more time and have a little bit more knowledge are more likely to get the right answer for you. So I hope that's been useful. Thank you so much for listening, and hopefully we'll see you on another webinar very soon. And just again, thank you so much to Feline Friends for making this possible. It's great to see a charity so interested in education, and this will be up on the site very soon. Do tell your friends about it if you found it useful. Take care, everyone. Good night. Bye-bye.